So you've just heard sort of 4 projects from us trying to do research which is policy relevant. But I think it's probably fair to say in the Policy Research Unit that even though our work is directly commissioned by Department of Health and Social Care, we sometimes have a kind of clearer idea or feel we've been more successful than others in terms of what we know the policy impact in the short term at least to be. So it does beg the question kind of how to do policy research, research of policy relevance, and how to do that well. So we're really pleased now to have a panel which brings together expertise from lived experience, clinical practice, academia and policy making to give us some initial thoughts on that, and then it's over to you to give your reflections and questions for the panel as well to come back onto. So I'm going to introduce people one by one as we ask them an initial question to get going on this. And our first panelist to speak is Raza Griffiths, who's a member of our Lived Experience Working Group in the Policy Research Unit, among many other things. So lots of work in education, but also lived experience research, including being the lead author on the Kindred Minds BME Mental Health Manifesto. So Raza, the kind of question we have for you is, how can people with lived experience help research projects to achieve policy impact?
Shall I go ahead?
Go for it, yeah.
So thank you very much for inviting me to be on this panel. So how can people with lived experience help research achieve policy change? The first thing I wanted to say is I think it's really, really a very important issue because what we're faced with is a mainstream, very dysfunctional mental health system. And Daniel Pouras, the UN Special Rapporteur on Health, I think it was in 2017, he identified that part of the problem that's keeping the status quo going as it is that the voice of people with lived experience is not heard often enough in synthesizing evidence, and that the whole kind of debate is very much skewed towards a biomedical model. So that voice really needs to be in there. It's really, really important to overhaul the mental health system that we include that voice. So, then turning to the question, I guess it's in 2 parts. One is around the research bit, and then the other bit is about the policy bit, which I don't know very much about, actually. But anyway, so I guess for me and for many others engaged in what we do, the end isn't necessarily just about producing, excellent research, but it's about achieving real and meaningful change in the services and supports that we get. That's, for me anyway, why I got into this. And so really then it's not just about research, but it's about this kind of interlocking system of funding, research, policy, and education. They're all interlinked. And I think people with lived experience don't really get a look in that overall system. And indeed, even the Mental Health Policy Research Unit, which has made, I think, valiant efforts to engage people with lived experience in the research aspects. Once the research is done, it's kind of handed over, and there's no real kind of monitoring of implementation or anything like that, because that's beyond the remit. So thinking a bit more broadly, I think that's what we need to be thinking about. There's a very kind of Byzantine, to put it politely, a Byzantine relationship between research and policy. And where is the accountability? Where are the power dynamics in all of that? I'm not quite sure. Occasionally you get very kind of charismatic people who kind of rise up and do something very interesting in a local area, which is supported by research, but then it just disappears because the funding disappears. There's no infrastructure for upscaling those interesting initiatives. A little bit like fireworks, on Guy Fawkes nights. But that's not what we want. We need the infrastructure to, roll out what the evidence is telling us works. Okay, so with that big kind of caveat, I'll just go and look at the actual research and the research within the Mental Health Policy Research Unit and how I believe the Mental Health Policy Research Unit really actually made very good efforts in terms of developing real and meaningful involvement. So what do we bring, people with lived experience? Well, first of all, there is experiential knowledge of services. Of course, academics and practitioners may also share lived experience, but I think their positioning makes it it's a slightly different kind of kettle of fish. But I think it's really important to nurture people with lived experience in research projects. And I think one important part of the support that enables people like myself to contribute my best is to have some kind of network of peer support within the research project. So within the Mental Health Policy Research Unit, there is some effort made to create peer support that's independent of, if you like, the actual Mental Health Policy Research Unit. So I think that's very important for validation, for a sense of shared understandings, shared agendas. So then, looking at, and the other thing to say is it's very important to have humility is very important, I think, for organisations commissioning mental health services and researchers. I think that doesn't always come easily to prestigious institutions to be humble, but occasionally they do get it wrong, and I think when they get it wrong, they need to kind of own up to the fact that they got it wrong. I can give you numerous examples of when this didn't happen, but one example of when it did happen within the Mental Health Policy Research Unit was a survey they did of mental health nurses during the COVID period. And the percentage of BAME nurses was really very, very low and didn't really reflect the disproportionate number of BAME mental health nurses, in the nursing profession as a whole, or the fact that that group of nurses was disproportionately likely to die or experience long COVID, etc. So I think it was very honourable for you to admit to that. I mean, you didn't make many mistakes, but you're only human, aren't you? So looking at the whole process of research, kind of funding, selecting topics, literature review, research questions, data collection, analysis and dissemination, what are the ways that people with lived experience can kind of contribute to all of those stages? Well, I can name some of them. So, for example, selecting the topic is a little bit difficult because generally speaking, funders just say, well, you've got to do this. But I think you have taken on board some of our suggestions as to the topics that people with lived experience feel are important topics. In terms of literature review, I think we asked the question that, do systematic reviews simply reify knowledge that excludes our voices? I mean, do the primary studies that systematic reviews are looking at, do they include the voice of people with lived experience? If not, we need to add somewhere that this is something that's missing, I think we can suggest ways of phrasing questions that are more valid because we have that personal experience of having used services. We sometimes come to different conclusions, I think, and different ways of asking questions. I mean, when it comes to asking questions and data collection, sometimes I think people with lived experience, because they have that shared experience, I think sometimes people are more open, they open up to us more easily, perhaps.
Raza,
but just...
I'm so sorry,
okay.
Could you come to a concluding point and then
Okay.
save further thoughts for the discussion?
Okay.
Yeah.
So I think hats off to the Mental Health Policy Research Unit, but the wider context is not one which has fundamentally changed and is still one in which I think people with lived experience are in fundamental senses disempowered. But that's not down to Mental Health Policy Research Unit. I think you're kind of on side as far as I can see. So, yeah.
Fantastic. Thank you very much. And our second panellist is Professor Steve Pilling, who's head of the UCL Clinical Education and Health Psychology Department and director of the National Collaborating Centre for Mental Health, making mental health nice guidelines. And I think the question we're giving you, Steve, is one that Raza was posing as well, which is, what do we know about how to achieve good knowledge translation from research into policy and practice?
I think the straight answer to that, Bryn, is probably not enough. But I'll try and set out some of the things that I think are important. And just to echo what Raza said, the centrality of the voice of lived experience has been something that's governed what we've done in the work with NICE and with the National Collaborating Centre for the last 20 years or so. But I think it might be helpful to just begin with a definition of what is policy. I take this from the Center for Drug Control in the US, or Disease Control, I've forgotten, CDC. And it defines policy as a course of action adopted by government which requires a set of clear principles to underpin it. It's action-focused, it has the authority of government behind it, and it supports the core business of that government organisation. And it's worth just holding those in mind, because I think if you're at the interface between evidence and policy, it's helping to understand where policy makers come from, and Veril can either confirm or contradict what I have to say shortly. Now, what about the evidence? Well, the evidence has to be strong, it has to be the best that is available, but I think from the point of view of an evidence into practice position, it has to be subject to formal scrutiny. So if you look, for example, could talk about this if people have questions, NICE has a very good formal structure for widely consulting on it. So you're not just presenting a review that you've cooked up in some back room at UCL. There's been wide public, professional, and service user scrutiny. So it's really important that that's there. The other really important thing, I think, about any evidence into policy is that you have to be very clear about your outcomes. What are the outcomes that the evidence is pointing to? And it has, I think, a lot more weight in political circles if that evidence can be shown to have value, if those outcomes, can be shown to have value beyond just the immediate, my mood has improved. And some rather nice evidence emerging, in fact, from Norway, which looks at, well, it rather confirms Richard Layard's 20-year-old hypothesis that if people recover from depression, they'll actually do much better in the employment market. So if you can actually show that there's a real value associated with it beyond the immediacy of healthcare, then I think that's really important. The other issue that I've learned over the years, again, comes back to this issue of outcome. And I think that if you are wanting to translate policy into practice, and that practice involves change in the nature of the treatments provided, then I think you should be looking very closely at those outcomes, you should be reporting on them, and they should be public. We have a publicly funded healthcare system. I think it's right and proper that the public is available of their effectiveness. It also needs to be targeted on key decision makers, and a major challenge often, and Veril can speak to this, I'm sure, is getting their attention, getting them engaged in the process, and sometimes the ways to do that don't have much by the way of academic rigor associated with them. They're about building personal relationships, understanding who are the right people to talk to at the right time. It does make a difference. And you often find yourself in these positions where you're having to make compromises. But those compromises, I think, should be made by the policy makers. You're presenting the evidence is there to be interpreted. I think you need to be really careful that you don't find yourself trying to fit the evidence to what's known. If people want to use that in a different way, well, so be it, fair enough, and that might be a good policy judgment. Moving on to practice, I think policy needs to make the clinical, the personal care, the case for change. A guideline needs to be setting out some rationale that whether it's RASA or somebody sitting in an outpatient clinic in North Camden can see that there is a purpose in following that up, following that evidence. And that needs to be linked to tangible benefits that an individual or a service sees them providing. And crucial to that, I don't think that evidence into practice, evidence into policy, can actually happen without a serious consideration of cost. And that's not just cost at what it might cost to the public purse, but it's cost in terms of cost effectiveness. And then there's the final couple of points I want to make about implementation, which is don't be greedy. Too often, people come to the process of change, of the implementation guide. I think this is a fantastic time to introduce a new policy and also save some money. It doesn't work. businesses don't operate like that. I don't think the NHS should. If we've got to save money and save resources, and maybe we have to in the current climate, well, let's do that. But not let's pretend that introducing a new piece of work would actually do that. Because the challenge of introducing new interventions is, as I said, not without cost. And I'll just look at my last comment. I'm amazed I forgot this. I mentioned it to Veril when he came in. But I think our life has been much more difficult in the last 10 years since the introduction of the Health and Social Care Act. I think it's been a bit of a disaster for healthcare. And I think, and this is a serious point, I think that we've got far too concerned with cost and not enough with benefit. And I think it'd be nice to be able to shake that yoke off. And at that point, I'll stop.
Thank you, Steve. Thanks very much. So our third panelist is Alison Cobb, who is Policy and Campaigns Lead at Mind and has worked for many years on leading Mind's campaign for better acute mental health care and more recently the response to the planned reforms of the Mental Health Act. So Alison, the question we had for you was how can voluntary sector organisations like Mind influence policy, and what's the role for research in your work?
Yeah, thank you very much. So influencing policy is just a big part of what voluntary organisations like Mind do, and it's, I think, a big part of what we're for. It could mean kind of pushing priority for mental health or parity, might mean making the case for changes to law or getting behind a service approach that has been shown to work for people. We might do it through reports and briefings and meeting with decision makers, through parliamentary work. We might use shoutier tactics through campaigning and media, and often work in collaboration with other organisations as well. The part research plays, I think, is just really important if we want evidence-based policy. For us, key evidence is insights from lived experience, and I think it's our job to help make sure that decision makers are hearing from people with the relevant experience, and that policy recommendations that we're presenting, that policymakers are hearing, are rooted in that experience. In terms of how we use research, we would be using published research, clinical, academic, survival research, to understand what's happening, to develop positions and build case. Like, for instance, thinking of the work that I've been involved in recently, the studies about community treatment orders, the work done at King's and UCL about crisis care planning, advanced choice documents. That's all really relevant to current policy and legal development and change. Things that we might do ourselves as an organisation, maybe more at the level of kind of surveys and focus groups and freedom of information requests. So, for instance, with Mental Health Act reform, we've worked on the Mental Health Act one way or another for years, but not really with young people. So we knew that was a real knowledge gap and therefore a real kind of legitimacy gap in terms of our influencing work. So we worked with a small group of young people to explore their experience and what they thought it was important for us to ask about in terms of other young people's experience of inpatient services on the Mental Health Act and about the government's proposals for reform. And so that work's been done, and our report and recommendations have been published as Our Rights, Our Voices, which is on our website now. So, but as well as that kind of, I suppose, smaller scale research, we'd also partner with other organisations like YouGov, like Centre for Mental Health. So kind of upping the research expertise, if you like, in the work. And also, I think the work we do could kind of feeds into the research agenda as well. For instance, we may manage to get headlines from a survey we've done or from freedom of information request highlighting a problem, and that can kind of push the research agenda, maybe inspire work that looks in more depth at what's going on there. And I think areas like physical restraint in hospitals, crisis care, discharge from hospital, are areas where that's happened to some extent. So, yeah, so definitely I would say a two-way street and lots of scope for collaboration.
Thanks very much, Alison. That's great. And I think, our next speaker, we've learnt in the policy research unit that having a policymaker in the room is one really key thing for any policy research. So we're really pleased to have Viral Cantaria here today, who currently Viral is Chief of Staff to the Chief Operating Officer at NHS England, but has previously worked in a number of NHS England roles, including on coordinating the Mental Health Act review and leading local implementation of policy within NHS Trust in East London. So Viral, our question for you is, what do policymakers want from research and how can they get it?
Thank you, and thanks for the invitation to be here. I'll try that one. So firstly, just to say, as Bryn mentioned, I don't actually work in mental health right now, but I did for a long time. So it's really nice to see some old faces and some newer ones too. And just to reflect on, I mean, it's clear, I was just in the session just now with all the excellent presentations, and the PRU has clearly made some great progress in the past few years. So I think that's really nice to see, having been involved sort of quite early on with departmental colleagues. So I think if I was to use sort of one word to answer Bryn's quite tangled question, I think I'd say understanding. And that probably sounds like a bit of a cop-out, but I think we've talked a lot about evidence-based policy making over a number of years, but I think the reality is that there is a lot of ideology-driven policy making. There's also a lot of headline-driven policy making. And it's not always binary, it's not black and white. These things can all happen at the same time. A lot does depend on the kind of political runes. But beyond the political runes, there's a lot that kind of sits between that and I think what people see. So you do have political decisions, but you also have policy decisions and huge amounts of sort of policy work that go in at any given time. So I think being sort of realistic, being alive to the context is really important, and that's from both perspectives. So policymakers being alive to the context in which researchers are operating, but researchers being alive to the context in which policymakers are operating. So I think there's something about the sort of imperfect and quite often uncontrolled conditions under which policymakers tend to operate. And I know that can be quite sort of uncomfortable in lots of ways for researchers. I've had these conversations a lot with researchers from kind of, all different types of backgrounds and different profiles of experience. But I think that is really important, and Steve's kind of touched on some of those points. I think, this is a conversation I've had with a lot of colleagues over the years on sort of my side of the fence, as it were, which is, a lot of papers do conclude totally understandably, by saying things like, we recommend further research in this area. Sometimes that can be a little bit frustrating. I'm not saying that shouldn't be said, but I think sometimes we kind of think, well, why can't there be a little bit more boldness in making some recommendations? And actually saw some really good examples in the presentations earlier of actually just taking that slight step to go a bit further and be a bit bolder, notwithstanding the fact that whatever you say does have to be based on the evidence available. I think there has to be a bit more give and take. So understanding both sides' expertise, I think the mutual benefits of understanding that both sides can bring, so just bridging that gap. And it's about understanding the achievement of goals on both sides. I do think there's a bit of an issue around timeliness, so the sort of lags between the research being undertaken and the paper being published. I know that's quite often not in sort of your control as the people doing the work and writing the papers. But I think sometimes that does bring a sort of issue in terms of a lack of sort of contemporaneous understanding of the policy developments and policy context. That might be because there are also so many and they're always changing. But I think there's a question of how researchers can become a bit more well-informed about policy developments as they're kind of happening in real time, and a bit of agility around that. I think there are still quite a lot of prevailing assumptions about how much policy being made at a national level kind of really directly influences and drives a lot of the things that are happening locally. Again, Steve has sort of touched upon this, but I think, there is a lot of power and autonomy in decision making that now happens at a local level, for good or ill. I'm not making any comments about that at the moment, and it wouldn't be appropriate for me to do that either in my current role. But the fact is things have changed quite significantly. So yes, of course, national policy makers still have a lot of influence. In many ways, they do make those macro level policy decisions about, overall budgets, but there's a lot of autonomy at a local level now. So there's something about how can researchers sort of branch out the sort of chain of communication, the engagement that can happen at a local level to directly get involved in decision making. Obviously, we have massive amounts of collaboration, King's and SLAM, for example. There's UCL Camden and Islington through people like Steve. So there are lots of examples. Hopefully, actually, we know that it's not just London-based, although London does benefit from that, from those really strong links. And I do understand people's frustrations about things like continuous reorganisations, and it is hard to keep up, but I think it is important. Otherwise, there is a danger and a risk of that continued sort of separation of going down these two tracks and that sort of divide becoming unbridgeable between research and relevance to policy. I think a couple of just last things from these conversations and the presentations earlier. So I think it's just an open question, really, that can sometimes a sort of purist approach and saying that there is a lack of robust evidence, can it actually become an excuse for inaction from decision makers? Potentially. I think that's a difficult question, but one we need to keep asking. I think as well on the money saving point, the irony is that a lot of the models and interventions that do have robust evidence behind them do save money in the medium to longer term, as well as ethically and socially being the right thing to do. So there's something about the short-termism and the medium to longer-termism bit. But my final point would be about collaboration, I think. So it's not just about sort of us on one side and them, and I know the irony of me talking about different sides of the fence, but I think there is learning from both sides. And I think that is really important because that's ultimately what's going to end up getting us all to the same goal.
Thank you very much, Viral. And last but not least, Sonia Johnson, Professor of Social Community Psychiatry at UCL and Director of the Policy Research Unit. So Sonia, a few reflections on, during the 6 years of this mental health policy research unit, what's worked well and what's been challenging in delivering research with policy relevance?
Thank you. Well, I'm quite pleased, actually, that several of my points do quite fit with what Viral's been saying, so hopefully we're not far from being on a similar page. So I think the context, the good news is, as I think I said at the beginning, that I think policymakers are interested in research by and large, and especially interested in it if it provides something that's actionable and if it provides it at a time when it's usable. So I think we felt on the whole that we're in a context where, in principle, people would like to talk to us and to make use of what we can provide. And, I mean, to be honest, we've also been quite impressed that really no one's tried to kind of nobble us. In 6 or 7 years, there's been no suggestion from anyone that we might have found anything other than we have found. So I think that's good, really, and quite impressive. So what are the challenges? Well, some of the challenges are just in getting to communicate with people in the first place. You have to have a lot of persistence in fitting in with diaries, making the right meetings. Video calling has actually been really helpful to us in being able to have direct conversations with policymakers. People moving around is pretty challenging, so you have a really good chat with someone who you feel is coming to grips impressively well with the thing that you're trying to research, and then unfortunately next week they've moved to the milk marketing board or something, and that's a bit disappointing when that happens. And there's certainly the speed of movement between specialist areas is faster than we would be familiar with in our world. I think there's a great dilemma that often people would really like to know the answer to questions if they can be answered by research. But as Viral has already said, so often the discussion section of a paper ends up as more research is needed. And I think it's hard to find a topic where you can't come up with anything useful following an investigation, but often honesty means it's quite limited. I think another challenge is really knowing whether you have made any impact. So when we applied for a second funding period, we have to fill out some quite precise questions about what exactly your impacts have been. But I think it's acknowledged that that's often very hard to know, that policy making has multiple stakeholders to attend to, multiple influences, and when you're one among a number of inputs, it's sometimes hard to trace what's really the research. And of course, even if you think the policies are good, there are so many forces in the world that may stop them being successfully implemented, stop them actually making a difference. So what works well? I think the closer you can work with policymakers, the more persistent, short of stalking you are in tracking them down, the better it's going to work. So we've become very keen to get policymakers in our working groups to generally keep on at them and try and communicate with them as much as possible. I think tailoring communication, people want the evidence they get to be realistic, so policymakers don't want us to oversimplify to claim something might work that we really have no reason to believe does work. But at the same time, I think being clear and straightforward and drawing out whatever is actually realistically actionable without overstating the evidence is helpful. We found policymakers are very interested in lived experience perspectives, in hearing those, in talking to researchers with relevant lived experience. That's something important that we can try and facilitate. Bringing things to life with models that encapsulate the points we want to make can be really helpful. And I think overall it's a sort of good stance is hopeful but realistic for a policy researcher. So I think we need to keep the quality up. There's no point in compromising on that. Otherwise, we're not doing our job. Somebody could just write a glossy report with anything in it if our research is not rigorous, even if it's quick. But I think you can hope that if you do good work and communicate it well, even if you can't see its effects immediately, there's a fair chance that they will emerge eventually somewhere, maybe locally, maybe even another country. So Bryn and I were quite impressed when we found out quite arbitrarily that some work we'd done on crisis teams was really quite underpinning for some mental health policy developments in Germany, which is one advantage of peer-reviewed publication. So essentially, I think to sort of keep on communicating, keep on keeping on really is the way to go as far as I can see. Thank you.
Fantastic, thank you. Thanks to all our panelists. So there's some reflections from a whole range of perspectives. What do you think? Questions, reflections from the audience? We've got two people with mics who'll come around and find you, so just do put your hand up and it would be great to hear from you. Alan, kick us off.
Thanks everyone, that was great. Vero, I'm going to pounce on you. I like your idea that maybe we need to be a little bit more forthright in our recommendations. If our recommendations are not in line with government direction, do you think they would be listened to?
Do I think they'd be what, sorry?
Listened to.
Well, it's a good question. I kind of think that's the balance between saying what you actually, well, there's a few different things. So saying what you actually believe, and if, what your belief is based on. So if your belief is based on evidence, but kind of what I said earlier, which is, yes, you can make some sort of inferences and therefore go a bit further with that, my personal view is I don't think we should purely tailor things just to what politicians, if we're talking about politicians, want to hear, because there'll be lots of other people who aren't politicians, who are policymakers, who may need to hear what you're saying. And they may be also writing papers and having meetings and discussions with ministers and saying, hang on, Minister, you said you wanted to do something about this. Here are some ideas that we've got that are underpinned by evidence. Now, that doesn't mean the minister would necessarily want to hear it or will do anything about it, because we know sometimes they want shiny new things. They want to chase shiny new things. And sometimes the answers might actually be, well, hang on, we've got a load of evidence about what works. Might need researchers to actually just push back and say, hang on, we've kind of done this all before. The evidence is clear. Why don't you just do that instead? So I think, there is something about being true to yourself and what you actually believe. If people don't want to hear it, that's kind of on them. But I think tailoring your messages to the widest possible audience that could digest something and review it objectively is your best bet, because you never know who's going to listen. And that can always, these things work in strange ways. So even slightly older ideas have a way of potentially coming to the fore at times. Hopefully good ideas, but sometimes not so good ideas, and we kind of know that.
Thank you.
Thank you. Any more questions for any or all of our panel? Yeah, at the back there.
Hi. You touched on the kind of current financial climate and how interventions, even if you think they will save money, cost money to implement. And I guess my question is, if you've done research or you've done sort of a case for change and there's strong evidence that something will actually, once implemented, save money or be very cost effective, but there's a reluctance to, or a lot of resistance to implementing something new because of the cost of doing that at the moment, what can you do to overcome those barriers?
Well, I mean, maybe again, Beryl can comment on this, but my experience of this, I had a brief spell as an advisor to Department of Health almost 20 years ago, and I did write bids for the comprehensive spending review. But I think what you do is it picks up on what everybody I think has been saying. You keep at it. You recognize that, again, this is anecdote, but it's quite striking. I was working on a project, it shall remain nameless, social minister. They thought they were moving departments, and a project that had been shelved because of a coming election suddenly became the project I will leave behind. And it was about I think it's being there at the right time, being wise to it, as Sonia said, building relationships. And then you start to be able to kind of support the change. But you have to put up with the fact that sometimes it doesn't actually go the way you want. Richard Laird, I think, with the IAP program is a good example of this. I mean, he spent some years patrolling the corridors of Whitehall with a good idea, waiting for the right moment to come. Now, that's a bit of an exception. And to be fair, I think, to Beryl and colleagues, and indeed to politicians, they're actually there to do good. They want to see things being better, and it's a case of trying to align what you're doing and building relationships like the PRU has, I think, is a way that you could start to make that happen. But it doesn't happen overnight.
Thank you.
So I think, just very briefly add to that, I think right now is quite a difficult environment because people don't want to or can't invest up front, right, a lot. So I think it is about plugging away because, quite frankly, some of these things are barn door obvious, but it's just that the money isn't there to invest up front. So that doesn't change the facts of, we have this problem and there's a strong evidence-based solution that suggests, firstly, it works for service users and or carers or whatever, and it also saves money in the longer term. I spent many years before I moved on from the mental health policy world working with quite a few people in this room, Steve included, around making a macro level case for investment in community mental health services for lots of reasons, not least one of the economic arguments being, well, if we keep people well in the community, they will not need so much crisis care or A&E care, et cetera, et cetera, et cetera. that's one of thousands of very strong, I think, arguments, and it's a crude one as well. Doesn't necessarily mean that we've won the day, but there are some really kind of obvious things that are difficult to do for a multiplicity of reasons, but if they are obvious, we should still keep talking about them unless it happens, basically.
Anyone else want to come in there, or shall we take? Got one more at the back there, Bev. Do you want to come in?
Thank you. I find myself thinking about the difference between reactive and proactive research. And as far as I'm aware, most research is responding to a need or a curiosity to investigate further and maybe come forth with recommendations. But if there was some if there was some research or something that we were aware of, I'm speaking as a lived experience researcher with the PRU at the moment, that wasn't yet on the policy radar, where would we go to get interest on that? Whose doors do we knock on first? How wide-ranging must that be? How do we gain traction? Is that something we should be doing, or should we just wait to be called?
I mean, just a quick initial response to that, and Sonia, others may have something to say. To specifically, NICE makes recommendations for further research. We're being asked to look at problem X, and there's no good evidence. So that's one way it develops. But NIHR and other organizations are places you can go to and say, well, look, this is an interesting topic. We don't really know what we should be doing here. So I think, and it may be, I mean, again, I think PRU issue, but or an NHS policy, there should be a dialogue about what it is, the direction we need to see research going in. And I'll just finish with one of my current research preoccupations. We have not improved outcomes for depression, either psychologically or pharmacologically, in 50 years. We're better at delivering treatments, drugs are safer, but the effect sizes are no better. And that's a call, I think, for a fundamental rethink about what we do about, quotes, the treatment of depression. And I think there are lots of examples, and I think it's for people here and elsewhere to just, bang the drum and make the case for more and different research, not just doing the same things.
I just wondered if either Alison or Raza have perspectives on this, or people trying to get research going or influenced from outside of university perspective.
Sorry. Yeah, I don't know. Don't know that I've got the best whatever on that, but just to say yes, well, don't sit on good ideas, I would say. But also, if there are, I don't know research world well enough, but if there are ways to kind of convening people to work through some of those ideas, and who in research world can kind of pick up and thoughts about, and if there's a kind of critical mass of support for that, then taking that to funders. I don't know.
So I think all I was going to suggest is, I think quite a lot of the time you might think, oh, this feels really lonely, but someone somewhere will be thinking similar thoughts or be grappling with the same question. So I don't think there is a kind of magic, solution to finding them, but someone somewhere usually, and they might be somebody working in a local health system or working in a trust or working in primary care or something, who's thinking, I've identified this sort of issue or this area of interest, and I think we need to do something about it. So I think, as kind of what Ali was hinting at, is, there are networks, even if some of them are invisible, but some of them are more visible, and I think MHPRU is the sort of thing that can engineer and galvanise some of that.
Thank you. Just doing a time check, I think we're at 1:15, aren't we, which is time for a quick break. But then we're all back in here for a short session thinking about lived experience contributions to our research, and then winding up, and then tea and snacks and drinks. So please stick around. But thank you all very much to our panellists today, and see you at 4:30.